Live, the morning show from KPSP Local 2, where local comes first.
Living in our sunny desert, it's important to take good care of our skin.
November is the month to remind us to do that. It is Healthy Skin Month. To give us some suggestions for keeping our skin fresh and looking young and healthy is Dr. Timothy Joshin, a certified dermatologist with offices in Palm Springs and Rancho Mirage. Good morning to you, doctor.
Good morning.
It doesn't matter what time of the year it is, you have to take care of your skin. First question for you, what is the most common skin conditions you see in your office, especially living here in the Valley?
Well, in my practice, it's basically thirds. I do a third general dermatology, which is rashes, a third surgeries, such as skin cancers, and I also do a third cosmetic surgery to reverse the signs of aging.
All right, so what are the worst things that you see walking in there? I know I just explained to you, I've got perioral dermatitis. That's not that big
in
of a
English,
deal.
that means?
It means I got a bunch of red junk on my face because I use MAC makeup and it really fills all the pores.
Oh.
Yeah, but for normal people, what do you see?
Well, you know, in my practice, the worst things are cancers, and a huge chunk of my practice is cancers. The most deadly, of course, is going to be melanomas, and we see melanomas every day. Some days I'll see 5 patients with melanomas.
Wow.
We also see basal cell carcinomas and squamous cell carcinomas. And then the bulk of my practice in terms of the medical side is going to be precancers called actinic keratoses. So we see a lot of that.
So you talk about melanoma, and we're talking about the sun here. So what do people need to do to make sure that they are doing the right things, taking care of their skin as far as cancer goes? Should they be looking at their skin every month, looking for signs?
Well, you know, we have an elderly population, or a mature population, I like to say, and, you know, people move here because they like to be active and they like to be in the sun. So it's really important to protect your skin from the sun. And I recommend sunscreen every single day. The other thing is, if you have unusual marks or spots that don't go away, spots that are bleeding, you really want to go in and see a dermatologist to get it evaluated. Because even physicians refer to me because they're not certain if something is a cancer or not.
Mm-hmm.
You mentioned acne on your notes here, and you know, I'm just thinking about acne. It seems something that 17-year-olds get, but you're saying not so.
Well, you know, people can have acne into their 30s, 40s, 50s, 60s. I have people of all ages that have acne, so that's something I treat all the time as well.
Is there something you can do to, I guess, prevent acne besides making sure your skin's not oily, or is that sort of an old wives' tale?
Well, you know, there's new data that shows that diet can have an impact on having acne. But, you know, acne is caused by 3 things, basically. You have plugged pores, you have oil buildup, and you have inflammation. So what we want to do with acne is we want to really treat the causes of acne with things such as retinoids, which will exfoliate the skin, cut down on inflammation. We can use oral or topical antibiotics to fight the bacteria. And so those are some of the things we do. We also have an old tried and true treatment that's called Accutane, which will actually cure acne and get rid of it forever in 70% of cases.
Yeah, I've heard. You take medicine, right? It's a pill.
Yes, it's excellent. People are afraid of it, but it's overstated. Really, it's a miracle drug, and I love it.
Now, to see the segment again, you can head to our website, kpsplocal2.com, click on Morning Show at the top of the page. But, Doctor, you're going to be back for the 6 o'clock hour. We're going to talk about some antioxidants that people can eat,
and
essentially, moisturizing. And it's cold now, so my skin feels dry. We'll talk about that as well, what you can do, right?
Yeah, look at that. Dry. Ew. Thank you. Your hand's ugly. Thank you, Todd.
Live, the morning show from KPSP Local 2, where local comes first.
November is Healthy Skin Month, and there are so many things you can do to prevent damage and stay looking fresh.
This morning we are joined by Dr. Timothy Joshin, a dermatologist, a dermatology professor at USC as well. Good morning to you, doctor.
Good morning.
Thank you so much for being here. So what should we be doing on a regular basis to make sure we have healthy skin?
Well, I like to keep it very simple. I think everyone uses a cleanser. A lot of people like to use a moisturizer, and a sunscreen is really essential.
Here are the things that I am shocked by. You say moisturizing may not be for you, and this is a shock because I've always heard, oh, you got to moisturize, you got to use this moisturizer, that. You're saying not so.
Well, moisturizers aren't necessary for everybody. Now, here in the desert, a lot of people are dry, so those people are going to want to use a moisturizer. A lot of women are really addicted to a moisturizer as well. You know, you hear people are addicted to lip balm. Well, a lot of women won't go out without a moisturizer. My thought is use a moisturizer that has added ingredients that are beneficial to your skin. For example, you can get a moisturizer that has sunscreen in it. You can get a moisturizer that has a retinoid in it, or peptides, or growth factors, or exfoliants, or something like that. So it's actually doing something that's really beneficial to your skin.
All in one, that's what I do. I just use one moisturizer and that's it. And what about an exfoliant when you wash your face? And we were talking about this off camera. I do the right thing as well.
Exactly. Bravo. So I love exfoliants. You can use retinoids, which are exfoliants, or some of the acids. And what they'll do is they'll even out your skin tone, which means your skin will be one tone. It can also stimulate collagen, which means less fine lines and wrinkles, and it'll make your skin smoother. So people love exfoliants.
For those of us beauty product challenge people, what is an exfoliant?
An exfoliant is just an ingredient that takes off the superficial layer of your skin, your stratum corneum, and so that's what stimulates the body to produce more collagen and takes off that discoloration on your skin, that ashy look on your skin.
So it takes off the dead stuff, basically.
It does, exactly, and stimulates new growth of your skin as well.
So at what point do you need to be worried about using all those products for anti-aging?
You're talking Botox, aren't you?
No, I'm talking about my mom, she uses different types of cream than I do because she says you're too young. You don't need these types of creams.
Well, you know, out here in the desert, we get so much sun exposure. You know, you really start to see the effects of sun damage on your skin at an early age. My daughter is 6 years old, and she already has freckles. And some people find freckles cute, but in actuality, they're a sign that you have sun damage. So, you know, it's important to start early on. And so I say as early as you start to apply sunscreen or a moisturizer, you want to start thinking about what you're putting on your skin so that it actually can benefit your skin as well.
So even if you come out of the womb with freckles? This is shocking to me because I mean, we got our Kate Cagle, our redheaded
She's just got to be a little bit more careful.
Right. Well, you know, most people don't come out of the womb with freckles.
Okay.
I rarely see that. So it's really, you know, my daughter started collecting freckles at the age of 2, and I was horrified. So, you know, that really is a sign that you're getting sun damage. And the fairer complected you are, the more vulnerable you are to, you know, the effects of the sun on your skin.
And what kind of tip would you offer to all of us watching at home as far as, you know, taking a look and making sure you don't have skin cancer, like maybe a self-exam?
Well, you know, I think everyone should look at their skin periodically and have your loved one take a look at your skin as well, because you can't see your back. But things you want to look for are atypical moles, and we always say the ABCDs. You know, A stands for asymmetry, B stands for border irregularity, D stands for diameter, and C stands for color variability. So you want to look for unusual marks on your body. And also, if you have a spot that doesn't go away, that bleeds, you want to see a dermatologist, because dermatologists are really the experts at evaluating spots on your body to make sure that they're not cancerous.
And it could save your life.
Yeah.
Exactly. If you catch even a melanoma, if you catch it early, guess what? You're going to live.
That is always good. We want to live. Thank you very, very much, Doctor. I appreciate you helping me out with my little situation here this morning off camera.
My pleasure.
Very, very much appreciated. And of course, helping out the Valley with all of our skincare needs. To see this segment again on our website, visit kpsp local2.com. Click on Morning Show at the top of the page. Again, thank you so very much.
Thank you, Doctor.